There is growing momentum around the world to put malnutrition at the top of the development agenda. There is an increased emphasis on multi-sectoral work, recognizing the important contribution the different sectors make to improving health and nutrition outcomes. Sectors such as agriculture and livestock, education, health, social protection, WASH, women's empowerment, trade, and planning are deemed to possess potential impact on nutrition outcomes. So far, there have been significant political commitments to working multi-sectorally in nutrition, but there's still a lot we don't understand about how these programs work and how they are operationalized on the ground. This video was created during the fieldwork in 2 counties of Kenya at the end of 2017. ENN conducted interviews with a wide range of stakeholders who are working on multi-sectoral programs to understand challenges and experiences at subnational level. With a population of nearly 50 million, Kenya has made some important progress on reducing undernutrition. As of 2015, it was one of the countries that was on track to meet the World Health Assembly targets for nutrition. Agriculture is the backbone of the economy and central to the government's development strategy. One multi-sectoral program being implemented in Kenya is the Accelerated Value Chain Development Project, or AVCD.
The orange flesh sweet potato value chain under the Accelerated Value Chain Project, which is funded by USAID. We work along the value chain from production of the orange flesh sweet potato through to marketing.
The health sector have representation on the ground in the name of community health volunteers. And we see this to be a good opportunity to package our good agriculture practices, to push the messages through these village health volunteers.
Not so. And moderate malnutrition. Yes, and what do we say about...
While we use the AVCD as a starting point to explore intersector engagements and their implication on the nutrition outcomes, we also broadened our perspectives beyond the AVCD program and spoke to various government ministries. We asked the stakeholders we met with what working multi-sectorally in nutrition means for them and how it is working in real terms.
Welcome, Lillian. How are you? Karibu sana. Yes, welcome to Homa Bay County. Multi-sector approach, this is a situation where we bring like-minded partners, like-minded sectors together so that we can have concerted efforts to ensure that malnutrition and issues surrounding nutrition like stunted is addressed.
Our target community are the same. The health officer targets the same community that the technical officer from agriculture targets.
The key element is the need. Most of them, they would see that they have a need of which if they would engage themselves with us, they will achieve it. You go to agriculture, you hear like they want to do some projects, but they don't have water. So what are our plans within a particular year as far as that area where they want to do activities concerned? So they come and we engage.
We spoke to the Homa Bay County Nutrition Coordinator about how the sectors communicated with each other through coordination platforms. The nutrition staff have been working through coordination platforms for some time and are now adapting their practice to engage with new stakeholders.
They realize that what they are doing is not just for them as that sector to maybe monitor their indicators, but also impacting on other sectors.
Yeah. So in other words, you sensitize?
We sensitize them through the different forums we have with them.
We wanted to look at implementation realities and listen to some of the teething problems of multi-sectoral programming on the ground. One of the issues that many stakeholders shared was that programs like AVCD were short-lived.
One of the things that we're looking at is, can we be able to have a joint work plan for the activities that we have within the nutrition? It's not something that is easy that in one time you'll be able to have people sitting and the next time people are implementing. It takes a long time and takes a lot of commitment. Yeah, for it to work, it needs a lot of effort and input.
Issues with M&E and evidence being gathered in silos was also raised.
Each sector is looking for its own indicators. If, for example, we are talking about a certain value chain, in that case I'm referring to a certain crop, like sweet potatoes. One can be interested in yield. The other one is interested in biomass. And then there is also a big gap in terms of information dissemination. The breeders do their work, we don't get the information. The researchers do their work, we don't get the information. Because there is nobody to bring us on board to understand some of these things.
Based on our conversations with stakeholders working at county and field level, we were able to draw out some key themes. One was the need for time. Another was the need for top-level coordination structures to ensure that coordination platforms were being utilized properly.
One of the recommendations is to have a very strong department that coordinates all the activities. That's all. Then two, to avoid a sectoral approach, to have a multi-sectoral approach, so that at the end of the day, the left arm knows what the right arm is doing, to avoid duplication and also to avoid negative development.
Lastly, the need for shared metrics to support this shared accountability.
If the Ministry of Agriculture and Ministry of Health at a higher level would look at what indicators that capture information on agri-nutrition, especially in the Ministry of Agriculture, and what we capture, they can come up with either additional or merged indicators, as long as the information is very clear on the indicators.
With the AVCD program phasing out, there is a big opportunity to consolidate evidence and lessons learned and data on nutrition outcomes. This is one of many similar programs being implemented around the world. Through learning by doing, the practice, design, and operationalization of multi-sector programs can improve.